Today I am going to present an interactive PDF file for patient having bleeding in early pregnancy. The first thing, we are going to take personal ID, so we are going to write the name of the patient, we are going to select what is the age of the patient, we are going to write the address of the patient. Also we are going to the nationality and the social status of the patient, and what is work of the patient, and what is the blood group of the patient, and what is the RH type. We're going to choose the habit of the patient. So she has no special house, she has a special house, she is smoking or not smoking, she is using alcohol or not using alcohol, or she has using recreational drugs or not. I want to start with the focus history for bleeding and early pregnancy. What is the chief complaint when the patient has this bleeding, and what is the last menstrual date? We are going to determine when the patient knows she is pregnant or not. If she knows, she is sure for the last menstrual date or not, and she was using hormonal contraception regularly for the last 3 months or not. And then we can calculate the expected date of delivery, and then we can calculate how many weeks the patient is pregnant now. Then also check that the patient has any investigation for pregnancy or not. She has pregnancy tests was done or not, and there was a serum pregnancy test, and what is the ultrasound findings if she has ultrasound findings. And then we have to differentiate whether the patient has pregnancy less than 14 weeks or more than 14 weeks. So if she is more than 14 weeks, we can ask her if she is reaching 16 weeks or more, she fetal movements or not, and how about the fetal movements day. And then we are going to analyze the vaginal bleeding, or the onset of the bleeding, the duration of the bleeding, and the cause of the bleeding. She's stopped or she has recurrence of the bleeding, and the amount of the bleeding, she is mild or moderate to severe, and the color of the bleeding, it is red or brown, or change of the colors from brown to red or from red to brown, and she has any previous attacks of bleeding or during this pregnancy or not. She has once or twice or 3 times or so on. And then any associated symptoms with vaginal bleeding, she has no symptoms or she has symptoms. These symptoms may be abdominal pain, and where is the onset of the abdominal pain, and the site of the abdominal pain, and the relation of the pain to the onset of the bleeding, and the site of the pain, and the character of the pain, and the duration of the abdominal pain, and the cause of the abdominal pain. The patient has feeling to fall or fainting attacks on, and then we are going to, patient has feeling of passage of fluid or not, has fever or not, and then she has any expulsion, sensation of expulsion from the vagina or not. She has expulsion, she has expelled tissues or fetus or placenta or the membranes or sac. The persistence of bleeding after expulsion. We are going to mention the past obstetric histories. We are going to mention the past obstetric history and past medical history and past surgical history and the family history, and then we are going to make the examination of the patient. The patient is fair or drowsy, and then we are going to measure the pulse and blood pressures, and to determine that the patient is non-tensive or hypertensive or hypertension. So we are going to determine the temperature, the respiratory rate, The patient is pallor, yes or no, she has jaundice or not, so she has no cyanosis to do the abdominal examinations. There's any abnormal findings on the abdomen or not, which there is no, we are going, if she has abdominal findings, we are going to record. There is inspections, normal blue discoloration or contract, abdominal distensions, or the patient she has any tenderness on the iliac fossa, or the size of the uterus is filled or not. Is filled, how many weeks we can determine, and then we have to determine that the size of the uterus is less than the gestational age or greater or equal to the gestational age, and then if the size of the uterus 16 weeks or not, we can auscultate for the fetal sound, and we can determine the fetal sound is valid. Then we go to the vaginal examination inspections, is apparent or no abnormal findings, or there is apparent findings, and this may be bleeding, blood coming out, or then no products is seen, or there's products outside the tissues or fetus and placenta, and then we can do speculum examinations, normal or no findings, and we have to determine blood loss or blood coming from the cervix and vesicles or umbilical cord or tissue. What we see, we have to record. Then we do gynecological examination of the vagina, nothing but blood clots and station sacs, and then the cervix soft or, and then the action to the movement of the cervix, and then the internal cervical os is open and closed, or the spongial membrane, Then we have to determine the size of the uterus, is normal or how many weeks and so on. And then the adnexa looks normal, or the adnexa findings is tender adnexa or left adnexa, and then the douglas pouch is normal, or there is abnormal findings of douglas pouch we have to mention, and then we do sometimes peripheral examination, especially if there is a mass in douglas pouch, and then we determine any findings on the rectal examination. And then we have to, if she has any report of investigation about the pregnancy, we have to record this, whether the human chronic gonadotropin level or the ultrasound find. At the end, we can determine what is the differential diagnosis. Is the case of abortions, or the case of ectopic pregnancy, or it is the case of molar pregnancy.